During this section, we're going to talk to you about getting back to normal. So we will be covering cardiac rehab, some physical activity and exercise. We'll talk to you a little bit about the early stages of having your device. We'll talk about returning to normal and what that means to you, some activities and things to avoid. So first up, cardiac rehab. It's an 8 to 10 week programme of exercise and education. Here we'll be able to teach you how to exercise safely, and we'll be able to monitor you closely throughout the sessions to help keep you safe. We can teach you all about your condition through education, advice and support. We will also be able to help you return to work, leisure and hobbies. Hopefully you should get back to feeling normal and enjoying the things that you used to enjoy. We will also help reduce your risk factors by becoming more active. Cardiac rehab will also help improve your confidence, help you getting back on track and feeling fitter, improve your quality of life, reduce any stress, anxiety and depression that you may have, reduce the risk of any further heart disease. It promotes a healthier lifestyle and it improves your knowledge of your condition and your device. And one of the main things, it also helps reduce your risk of social isolation.
The next part, we're going to look a little bit more about physical activity and exercise and how we resume back into those activities. So before we start on the specifics of physical activity and exercise, we're going to commence with some top tips. First, with your arm movement, if you limit your arm movement above your head and on the ICD side. Also, avoid lifting heavy objects with the arm that is on the ICD side. Third, when washing or combing hair or doing activities like that, move a little bit more slowly. Fourth, you can gently rotate the shoulders. You can also move your head from side to side, and this is good at avoiding stiffness around the neck, shoulders and arms. You can also build activity into your everyday routine, and that will help your recovery and it will keep you and your heart healthy. At the start of activities, we would normally do a warm-up, gradually building up, and also allow yourself to gradually slow down towards the end rather than suddenly stopping. When can I get back to activity or exercise? So cardiac rehab and keeping active. It's a vital part of your long-term recovery, and it's as important as taking your medication. With the cardiac rehab and the exercise sessions, you'll be invited to attend an initial assessment. This starts at a level that you can manage, and it will include a mix of exercises and adapted for you and any other conditions that you may have. It's aimed for everybody, and it gets you back to as full life as possible. Attendance on the programme is usually once or twice per week, and usually around 8 to 10 weeks, depending on the class and the location. The next couple of slides are just looking at some more specific activities that you may have some interest in. This one is about swimming and water-based activities. A common question, is this safe? Yes, once you've had your cardiac assessment at cardiac rehab. What strokes are best? Breaststroke is suitable for all devices, although front crawl, backstroke and butterfly can potentially damage or displace leads, so it's best to avoid repetitive strains in activities like that. Added safety, it's advisable to have someone with you or be in a pool that's supervised. Golf can be a popular sport, or activity, and the advice is similar as swimming. You'd need to consider your current fitness, the course, terrain and distance that you're going to be walking. You may need to alter your technique slightly, and the main key message for this sport is avoid overstretching your arm to protect the leads during your follow-through phase of your swing. Next, we're going to talk about racket sports. If your device is implanted on the same side as you hold your racket, this could cause problems with the repetitive straining of the device leads. Therefore, this activity may not be recommended. It will depend on the type of device you have, the racket, the sport and or your technique as well. Ideally, this needs to be discussed at your cardiac rehab sessions. Strength training. It's also called resistance, or can be called weight training, and it's where we use the body weight or free weights like dumbbells, weight machines, medicine balls or resistance bands. This improves and maintains your muscle and keeps you functionally strong. It also helps reduce risk of falls. It helps your activities of daily living by making them easier. It reduces the workload of the heart, and it can increase your bone density and help with body weight management too. The key message for this activity is avoid heavy lifting or raising your arm above your shoulder height within the first 6 weeks of your insertion of your device. You can delay up to that point or adapt your strength training until then. These are some other activities that you may be interested in, such as gardening and cycling, but the principles are the same principles as we've talked about for the other sporting activities. So you just need to be a bit precautious about when you're using upper limbs on the side of the device. For gardening, you may need to be precautious about using power tools, and that is something we're going to talk about a little bit further on in the presentation. Cycling, to begin with, you may be able to start static cycling sooner, and then you're going to progress towards outdoor cycling after 6 weeks once the ICD is fully inserted in and bedded in.
Sexual activity is perfectly normal to continue with after you've had your device. What we do advise is trying to avoid direct pressure on your wound for at least the first 6 weeks. The likelihood of your device shocking during sex is very, very rare, but still possible. The shock will not hurt your partner, and that's what's really important to remember. During sex, you will not raise your heart rate high enough to set off the device, so please don't worry about that either. If you're considering becoming pregnant, please consult your doctor. Your underlying heart condition will determine the advice given. The next set of slides are going to be going through some frequently asked questions. These questions may be really important to you. So our first question is, can I still drive? Yes, you can, but under certain conditions. And that will depend on whether you've had your device fitted through primary or secondary prevention. And this will have been covered in the first presentation. So if you've had your device fitted through primary prevention, it will be 4 weeks. If it's through secondary prevention, it will be 6 months. Now, in that time or any time after driving, if you do have an appropriate shock, and we will tell you if you've had a shock that's appropriate, unfortunately, it's a further 6 months, regardless of the indication for your implant. If you hold a Group 2 licence, HGV or PSV, then unfortunately that will become a permanent bar. So our next question, can my device set off anti-theft devices in shops? No, it won't, especially if you walk through as normal. However, we do advise that you don't idle between the panels because it can confuse them into thinking that it's a security tag and it can trigger the alarm, so try not to linger. Be aware that often at busy times shops may increase the frequency of these gates, and it can increase the chance of setting off the shop security alarm. But please don't panic and show your ICD card. At the airport. So typically there are two types of scanning gates that we will see. There's the one on our left, which is an X-ray scanner. This is absolutely fine for you to go in with your device. It will not cause any harm to your device and you can go through as normal. The one on our right-hand side, however, is one of the old style gates, and we advise that you don't necessarily go through it. Also, the handheld devices are advised to keep away from your ICD in your sight. Please take your ICD card to the airport with you and show staff during these times. It's really important that we recognise certain things to avoid. So the first one is the hydroelectric dam or the Hoover Dam tours. So these are typically found in places like Las Vegas, and the main reason why we advise not to go there is because we're uncertain of the magnetic intensity within the dam, so we can't guarantee your safety. Also, an abdominal stimulator. So these abdominal stimulators are strong enough to devise electrical stimulus to make your muscles twitch. So therefore not advised to use around your device. Also, there's TENS machines. So these are often used to help stimulate muscle, to help with any kind of injury. Now, these TENS machines have been known to deliver inappropriate shocks. So if you would like to use a TENS machine, we advise that you bring it into clinic and we can test it with you while you're in a safe environment. This will be reviewed on an individual basis, and we advise that it's below the waist use only. Earphone headsets. They're absolutely fine to use as normal. However, we would advise not to dangle the headphones over your device. Also, it's really important that you avoid putting your mobile phone in a pocket next to your device. Please try and keep your phone at least 6 inches away from your device at all times. Induction hobs. So these are cookers typically found in your kitchen. Unfortunately, you would need to be at least 10 to 12 inches away when cooking, which obviously isn't ideal. Also be mindful that standing near this for prolonged periods of time may interfere with your device, and it's not advised. If you do have an induction hob but you don't normally do the cooking, it's absolutely fine for you to walk in and out of this area as long as you don't idle there. Magnetic phone cases and iPad cases. Just to be aware that they do contain magnets strong enough to potentially have an impact on your device. Try not to rest them over your chest, and try also not to fall asleep holding them, as they can then fall over your device. Remember, they are still safe to use and have, just be conscious of the above. So now we're going to be talking and looking at a couple of everyday objects that you may come across. The first one being the Hoover. It's absolutely fine to use the Hoover and continue with normal housework once you've had your 6-week check from clinic. Heart rate monitors are also fine to use. You may even be asked to use one of these in your cardiac rehab session. Hair dryers and hair straighteners are also fine to use. However, we do advise that you avoid TENS machines, especially on your upper body. If you would like to use a TENS machine, again, please make sure that you bring it to clinic and it's been tested appropriately and it's only used on your lower body. Unfortunately, induction hobs are not one to stay near. Some of you with new devices and new leads may be absolutely fine to go into an MRI scanner. CT scanners generally okay, but if you do need an MRI scan, it's really important that before you say yes to anything, that you speak to your team at LHCH in clinic, and they will advise you on whether it's safe to do so or not. Again, avoid Hoover dams. The microwave is absolutely fine to use. What we would advise you is put whatever you need to put in the microwave on and then walk away until it's ready. The radio is absolutely fine to use. Mobile phones are fine to use. Just make sure that you don't keep them in that top pocket. And power tools and drills are also fine to use as long as you keep them at arm's length away from your device. Remember, your device is there to help keep you alive, and it's really important that you take up the advice given today. If you haven't been contacted by your cardiac rehab team, then please contact the Trust.